Hello, I'm John Kanellopoulos, Clinical Professor of Ophthalmology at NYU Medical School in New York City, New York, and Medical Director here in Athens at the LaserVision Institute. It's my pleasure to share with you the next generation of collagen cross-linking applications with the PiXL 2 device by Vidro. This is quite an elaborate cross-linking device. As you can see, it has a patient module. This shifts and is placed over the patient bed, can fit between our femto and excimer laser, or over a freestanding laser bed. This is magnetically locked and unlocked, and it has a nose camera, as you can see here. We'll see it later in action, and an XY axis with a tracker to track the actual pupil of the patient during the procedure. What's very exciting with the PiXL 2 is the fact that we can really customize treatments to pretty much any extent. Okay, let's see now how we can use this device to import treatments. One way of importing treatments is through a flash drive, and this is the, as you can see, the PiXL 2 preparation screen. We're inserting the flash drive with a predetermined treatment. We're going on to the touch screen menu. I'm going to find all the patients prepared here. And this is a treatment where we treat astigmatism and some lower keratoconic treatment. We're going to go here now to import a data from a new hypothetical patient. So we're going to try and design a normal myopic treatment initially. So patient, date of birth, usual data similar to what we use in excimer laser. Now that we have that theoretical patient put in, we're going to choose from this menu several predetermined patterns. We're going to choose the myopic pattern that we lay now in center through this touch screen on the screen. We can increase or decrease the diameter of this myopic treatment. We chose 7 millimeters, and we can XY decenter it to the pupillar axis if there's significant angle kappa. Here we're changing the fluence, and now we're basically adjusting the pulsing and the fluence per centimeter square that we desire to be used during this model myopic treatment. This is what it looks like as a final result, and we can see it right before the treatment. We'll activate the instrument with the treatment card, and then after soaking the patient's cornea with riboflavin, we will go ahead and treat. We'll show you here a different treatment. This will be a freehand treatment. So with topography in hand, we can freehand draw an area that we'd like to treat on the eye. And as you can see, this gives a multitude of possibilities. This is now just an arc treatment to treat, for instance, over a new or reopened astigmatic keratotomy, and we've published the ability of this treatment, and we're adjusting the arc of that treatment and its axis and its decentration XY, depending on what the data are on our clinical exam and topography. So you can see all the multitude of customability that this device can offer. And then again, going back to adjust total power delivered to the cornea, the width, the dimensions of this arc treatment that could be an astigmatic treatment. Remember, per the work by B.J. Dupes, so we treat astigmatism on the flat axis, not on the steep axis. This is the second arc now that we're going to design, and again, bring up to the same parameters if the astigmatism is irregular. Create irregular parameters if the astigmatism is irregular, in order to obtain as much as a regular result as possible. We can move the treatment to the center of this, and you can see this is an irregular treatment. We're going to treat more in the inferior than the superior, and we can also adjust different fluences and different total energy for both of these treatments. This is one of the very elegant options of customability that this device gives us. So now we'll show you real treatment on treating this irregular astigmatism. We're going to use first drops, as you can see here, through a speculum, riboflavin drops for 10 minutes, and then import the pre-designed treatment and place through the electromagnetic locks the device over the patient's eye, as you can see here. The device will sense the pupil and gives us the green light. We adjust the height, up and down adjustment, and you can see here the treatment in action, pulsing, continuous tracking, and then once we're done removing the device, you can see the remarkable difference before on the top or on the left here and after on the right, and significant treatment of this irregular astigmatism with just light, with just the customized treatment. Okay, so now here after our hyperopic LASIK extra, here you're seeing hyperopic LASIK treated with very high fluence in our results published at the Journal of Refractive Surgery on stabilizing hyperopia. You can see here, just with PiXL, no tissue removal, some extremely regular astigmatism correction. We'll show you some toric correction seen here. This is the standard treatment and the astigmatic treatment on the flat axis, and results top left keratoconus, right next to it progression, and on the bottom after PiXL treatment and dramatic treatment improvement on the right of the topometric indices. We'll go into myopic treatments, and these are 7th month data. Before on the left, middle, after, and the change on the right. So myopic correction only with cross-linking. Here a hyperopic correction. You can see 6 to 9 millimeter optical zone. This is schematic how it works. We treat the hyperopic zone, and these are the impressive top, patient number 1. After is in the middle, and change on the left and bottom. These are hyperopic corrections with PiXL or presbyopic correction. A little brushing on a very new picture and a new page in collagen cross-linking. This is John Canelopoulos signing out from Athens. Thank you very much for your attention.